Hi, everyone. This is Dr. Victoria Andarcia on the Healthy Roots podcast with Lienna May from Lucky Avocado Nutrition. Yes. So, Lienna, thank you for joining me today. Can you tell me a little bit about you and about your practice?
Yes, thank you so much for having me. I'm excited to be here. I am a functional medicine nutritionist. I got my master's degree from the University of Bridgeport. I am very, very, very passionate, just like you, about finding the root causes of health issues. And for me, it's working things through nutrition, but also taking and incorporating a whole body mind approach to looking at someone's stress, exercise, hormones, nutrition, all of it too, because all of it plays a role. I specialize in acne, blood sugar, gut issues, and hormones. And I came into this field too. I was struggling with a lot of health issues myself. I was overly stressed. I was working full time, doing grad school full time. I know you could relate to that too. And it was just a hot mess with my health. So I needed to work on my health too and put some of those priorities in my health to be able to help others. Yeah, and my practice called Lucky Avocado Nutrition, and I love helping people finding their optimal health.
Okay. Uh, Thank you for sharing. And then one of my questions is because I think not a lot of people know what functional nutrition is. So, what exactly is that, and why did you go down that route? What introduced you to that?
Yeah, that's a great question. So right now in the US, we have two official licensing and like two ways to go about it. So there's a traditional registered dietitian and functional medicine. Mine is called Certified Nutrition Specialist. I got my master's degree. I decided to go this route because it was more closer to my heart, what I believe, and it wasn't just like all surrounded about calories, but a little bit more in depth into like what are some of the biochemical processes going on in the body, from organic acids to more in-depth testing to a little bit of genetics. So really getting the whole mind-body approach, and that was like something that was close to my heart because I always feel like I can tell my clients to eat broccoli, but if they're overly stressed, then we're not going to go too far with that. So we need to work on all aspects of health. And I just loved a little bit more of that, getting to the root causes, because that's the biggest difference. We really want to find what are some of the imbalances in the body, what's going on, and how can we help bridge that gap and help someone feel better and not just treat their symptoms. There's time and place for medicine, of course, but if we can find the root cause and help someone feel their best, then we know we can prevent chronic health issues down the road and also help them feel their best.
Okay. That is a big difference because I see a lot of nutritionists in the hospital, and
Mm-hmm,
it's just like you said. I feel like it's very surface level.
mm-hmm.
Like this is what everybody with diabetes should be eating, and I like that you're getting down to like the root cause and using organic acid testing. So you do order functional medicine tests and you interpret them for people.
Yeah, we do everything that's inside the scope of nutrition. Of course, I can do, for example, like a chest x-ray that's outside of my scope, but everything that pertains to nutrition, yes. And Dr. Andarcia, you brought up a great point. Why functional medicine is different because it's all about personalization. Whether for you as a doctor, for me as a nutrition, we don't have cookie cutters. We always look at every person as a unique person, what they have with their history, trauma, health, and we can create that personalized treatment plan. So that's the same for us with nutrition. Like you said, someone with diabetes might have a different approach that someone also, the same person who has diabetes, but they are in a different life stage or have different things going on. So I do believe that we all deserve that personal approach because that's where you really get to see the amazing results.
Yes, I definitely agree with that. And so, selfishly, I'm going to ask you about something to back me up with my patients because I work a lot with gut health as well. But one
Mm-hmm.
thing that I think is very overlooked, and I can say it so many times until I'm blue in the face, but I need to back up. How do you think that stress impacts the gut? Does, if anything?
Yeah. Oh my goodness. just a huge impact. I think you probably would agree, just in general, our lifestyle was fast-paced, eating on the go, always stressed, burnout, anxious, depressed, all of that is like such a rampant in our country. Unfortunately, I think I'm coming from Europe and we do have a little bit of a slower pace there. Not as much here. I do feel like here it sets us up for failure with this lifestyle when people don't have time off. They overworked, so there's such a strong connection. First of all, there's a lot of research that backs up gut and brain connection. So if we feel stressed and anxious in our brain, then we send signals because we have so many neurons in our gut health that they communicate bidirectionally back and forth to each other. So let's tell my clients in plain, simple terms, if our body is thinking we have to run away from the bear, even if it's not the bear, we're just stuck in traffic or we late on a work deadline, our body is just not going to prioritize like digesting or absorbing of nutrients. It's not in that parasympathetic, which is like calm, rest, and digest mode. It's fight and flight, where I have to run away from the bear, and digesting, absorbing foods is not my priority. So a lot of times that's going to lead to more insulin, more cortisol, so that disrupts your hormones. But on top of that too, we're not digesting nutrients, so your body is a lot of times that can lead to like issues with bacterial overgrowth, just because nutrients either go through your body too fast, you have diarrhea, or too slow, you have constipation. So then the bad bacteria is like, oh, I have a time to party here, might as well get out of balance. So that can lead to dysbiosis. And just in general, too, when we're stressed, your body's not going to make enough digestive enzymes or absorb nutrients really well, all of that. So that can lead to more dysbiosis and all of that. So, yeah, such a strong connection. And that's why a lot of people, when they're stressed, they'll have diarrhea or
Mm-hmm.
stomach cramps or constipation, just because your body's telling your gut and they talk back to each other. And then too, with stress, another aspect of it too, a lot of people don't know about, we start breaking down that gut barrier, so that can lead to intestinal permeability, also called leaky gut. And then we have all of these foods, they leak into your bloodstream, and they can your bodies then think, I have an invader, I have to attack it. So that can lead over time to autoimmune conditions, thyroid issues, imbalanced hormones, and so food sensitivity. So it's like a vicious cycle with that. Yeah.
Yeah, very connected. And it's funny when you said um, that the gut issues can lead to trouble going to the bathroom, because in residency, I thought I had IBS, right? And everybody
Hmm.
knew that when I got stressed, like I had to go to the bathroom. But then I started meditating and it completely went away, like completely.
I
So
love it.
that's what I tell my clients, because it's just, I didn't realize. I just thought I had a intestinal, I was like, I have to go see a GI doctor, something's wrong. But it had
Hmm.
nothing to do with my stomach and everything to do with the stress that I was carrying. So how do you integrate that? Like, what would you tell, let's say if I came to you in residency and I had no idea that the two were connected, how do you help a client kind of see, like, what changes do they need to make so that they can see the correlation?
First of all, we all need to learn, like, be more in tune in our body too. Most of the time we really push it away, or as a woman we learn to believe, oh, if I'm bloated all the time, that's normal after you eat a meal, or constipated, and we'll define that like we really want someone to poop once or twice a day at least, because I know sometimes people don't know, oh, I poop twice a week. Like, no, that's not great for that. So, being more in tune with our bodies, to listen to when we feel overwhelmed, what's going on. Also, do we feel a stress in our chest, in our gut health? So, that's the first step, creating that awareness. And then I always, almost all of the clients, I say, hey, let's meditate for 5, 10 minutes. And people say, oh, I'm too busy, I don't have time to meditate. I said, if you don't have 5 minutes in your life, then we have to talk about everything else because we just have to find that time for your mental health. And I can relate to that too, because I was in grad school and I was so stressed. And that's when I started meditating, and it helped me like be more focused, like do better with my exams, recharged me, lowered my stress, also lowered that like I have to run to the bathroom because I'm so stressed. And so we start with that. We start incorporating like what can we do? Can we go a daily walk? Can we incorporate some, if someone's super stressed, gentle exercise, some type of movement, yoga, meditations, deep breathing, and really finding what works for some people. Some people really love walking, and a lot of people say, oh, I can't concentrate with meditations. My brain is just all over the place. I always tell them it's just like a gym workout. You have to train your brain like a muscle to sit and relax because it's going to be like a monkey jumping all over the place at first. And you just keep training. But that's like the first step, just having everyone to have those tools to be able to lower their stress because we're all stressed, but and also helping them become more resilient too to stress.
Yeah, no, I agree. And thank you for backing me up on that because I feel like sometimes my clients probably think that I'm making this up because I just want everybody to meditate. Um,
I know, I know.
but I'm glad that you agree and that you practice the same thing with your clients because I think that's super important.
Yeah.
Well, so my next question, because I work a lot with women mostly in my practice, and I have worked a lot with women who are trying to get pregnant and struggling to get pregnant for various reasons. And I think that one of the things that is overlooked when they come to me is their nutrition or like supplementation because their doctor just says take a prenatal and you're going to be okay. But we don't really
Mhm.
look at like the other life factors, including nutrition. So, what would your recommendation be for someone in that phase of life?
Yeah, first of all, I always recommend for everyone wanting to get pregnant to start really looking at their health and optimizing their nutrients and taking prenatals at least even 6 months before they want to get pregnant because like get their nutrients up and in the optimal health because a lot of times women go into pregnancy or trying to conceive, they're already depleted from, like you said, from stress or not eating well, not taking a good care of their mental health, because we know studies do show women who are really stressed, it's much harder to conceive too. So they're still finding out all the research behind it, but it does make it harder. So this is a great time to incorporate those stress management tools, but also think about nutrients like all the B vitamins that are so important for methylation, choline, B12, like folate rich foods, which we get from those beautiful leafy greens. Also, the big nutrient too, iron. You know, a lot of times women can also go into pregnancy, they're already low on iron, so then they have to get IVs or supplements. So, we really want to get those iron rich foods, whether from animal based or plant based, all together, just to get those levels up. But also start moving their body. So they're in a healthy because a lot of times I also see blood sugar imbalances or extra weight that can also affect their issues, which can lead to imbalanced hormones, PCOS, or maybe too much testosterone, estrogen, all of those hormonal imbalances when their periods are not regular. So this is a good time to start working on those, but also adding some of those amazing nutrients like also CoQ10. A lot of people don't know about it. It's really good for egg quality, egg count, getting the nutrients up, and it's high in wild caught salmon, broccoli, nuts, seeds. So getting those nutrients up, drinking lots of water, trying to get lots of sleep, because when those babies are born, you don't get a lot of sleep. So working on that and definitely also like stress management to help, and also another factor too, getting a lot of those healthy fats, omega-3 fatty acids that are anti-inflammatory, because we just a lot of times eat standard American diet and we have a lot of omega-6 which are inflammatory. So we need those healthy fats to balance hormones, but also support baby's growth and development and help mom prevent depression down the road. They've seen in research studies if their omega-3s are low, they can often later maybe struggle with depression, so I want to prevent that.
Mm.
So eating those like wild caught, sustainably sourced, amazing yummy foods loaded with omega-3s, but also nuts, walnuts, chia seeds, and prioritizing those because our body doesn't make omega-3, so we have to eat them
Mm.
from foods. So Yeah, those are like the biggest things. I know it seems a lot. And also even for partners, for them take supplements as well. Have also the doctor test the partner, look at their hormones, look at their testosterone, look at their health too, and work together to get healthy because then you give the best chance of getting pregnant.
Yeah, and cool thing about the omegas, because I didn't know about the depression part, but I have read that for women taking the omegas, it decreases the risk of allergies in
Hmm.
maybe afterwards.
Yes.
Yeah, so that is very
Yes.
good too.
And
And
another, yeah, I wanted to add too, like if we're going back to the gut health too, even optimizing that because when a woman later give birth, the baby gets that gut microbiome from her mama, so it's important to like eat fermented foods and supplement if needed, and that all of that to work on the gut health too. So you go into pregnancy and you can give the best microbiome to your baby as much as you can. Things can
yeah,
happen where you have to have a C-section or different things, but just to help optimize those nutrients too.
yeah, no, that is very cool. And from I listen to a lot of podcasts that
Me
the
too.
health, the health of the parent, right, really affects like the longevity and the health of the baby. And I don't think that we look at it or like think that far ahead. Like if I'm healthy now, I can, make things a lot better for my child down the road. So I
Yeah.
do agree with what you said. I was going to ask you how far ahead, and you answered my question. So 6 months ahead is when you should start thinking about how do I optimize my health.
Yeah, and a lot of women don't know about this too. Even when they're pregnant, because I've gone through this myself, having my daughter, that all the foods she's eating during pregnancy, we expose the baby to all these flavors. So then we set them up for success where they'll be less picky because they already can taste like ginger and garlic and there's fresh herbs, like traces of those foods being inside mama. So all of that already starts a great start for them to help get these foods and optimize their health. So they're less picky and all of that. So it's all important. And a lot of times in the first trimester, women can struggle with like, um, nausea, all of those. So this is where it's important that you can like get your nutrients up and go into pregnancy well nourished too, so you can sustain yourself and help you do that well.
Yeah, no, that's a very good point. Okay. So changing phases in life. So that was
Yes.
for for fertility. Now what about menopause? Because I know that requirements change during menopause. So how do you help people or women in that transition?
Such a good question. So it's interesting again, going back to like a big personalization for every person, but probably if to say more of the broad terms that works for really for everyone with menopause, a lot of times if someone is on a hormone replacement therapy, we really want to also like work and optimize their gut health. Like we want to eat fermented foods, we want to nourish their gut health because a lot of those hormones are made in the gut or gut supports that. So if you have dysbiosis, then that can create extra issues. But on top of that, really, I encourage all my menopause clients to eat lots of like colorful veggies, fruit, purple, green, a lot of leafy greens, cruciferous veggies, because they're really high in DIM compound, but they're also going to support like a liver, natural, gentle liver detox, but also recycling those hormones. Because if someone, I see this with a lot of menopause women, they're constipated. So we know if they're constipated, that poop just sits there way too long where they recycle their cholesterol, their hormones, which can lead to more hormonal imbalances, elevated cholesterol, more gut issues. So really encouraging them to eat broccoli, Brussels sprouts, bok choy, all of those nourishing foods to help like recycle their hormones, support their liver detox naturally and optimal health. Also eating those omega-3 fatty acids too, just to help with lowering inflammation in general, moving their body. And it's interesting, some people like in that stage of life do well with intermittent fasting. I feel like some women don't do as well. So that's where again I would want them to work with someone like you to find like what really works for them. If someone is overly stressed, maybe intermittent fasting not the best thing for them because it puts more stress for them. Or the same like with intense hit workout, if they're overly stressed or in chronic pain, it's not might be the best for them. Maybe walking, biking, gentle movement is best. And also like back to mental health too, that they need to work on their mental health, incorporate meditations, movement, this quality of life, finding their purpose too, doing something they love, finding the time for self-care. And I know sometimes people think of self-care like a spa, right? But for a lot of times it could be just journaling or keeping a gratitude journal or going for an acupuncture or massage, something you need that your body can get that I have an aura ring and I could see where if you like get to do some of those restoring activities, it helps you lower your stress, helps you prepare for a good night of sleep. Because in that age too, you're right, like a lot of women also struggle with their sleep and hormonal imbalances. So getting that beautiful sunlight exposure in the morning, just 5 minutes. I always tell all my clients, like your best night of sleep actually starts in the morning. When you go without glasses, before you have your coffee, and I know it's easier for us to do in Florida. We always have sunshine. It's harder for colder climates, but getting that sunlight exposure in the morning and that sunset just to help kickstart their day for a good sleep. I know it's a lot. I just want to give people a lot of practical tools, but
Yeah. And those are practical tools. And I think, we're focusing on phases of life, but I think that these are things that, I mean, you and I probably do on a day to day,
mhm.
right? But
Yeah,
for people who are not aware, I think these are good. It's good information because you can pick and choose and start with one and kind of add as
yeah,
you.
exactly.
So
And I want
I
to
was going to
add
say,
to, yeah, go
go ahead.
ahead. No.
No, I was going to say you mentioned DIM,
Mhm.
which is a supplement I use a lot. So I wanted you to kind of say like, what's DIM and what would you use it for? Why is that important?
A DIM is great. It helps support that natural detox and hormonal balance. A lot of times, again, if people haven't got issues or constipation, they're recycling those toxins, so it helps support proper detoxification, but also really good for balancing hormones, like you said, for menopause, but also for women who may be trying to get pregnant too. And that concentrate of DIM is actually high in cruciferous veggies, so that's why we're encouraging these too. But sometimes some people really need that supplement to really get higher levels to help them if they're really struggling with a lot of issues. So yeah, it's a great supplement. I like to use that myself in my practice too. It does help
Yeah,
tremendously.
it is
Yeah.
very. The other one that's very helpful, just going on a tangent, is beta. Well, not beta. It's calcium D-glucarate
Yes,
because
yes, yes.
that
Mm-hmm.
helps a lot with like that. So just
Yeah.
because you and I already know, and probably anybody listening is going to be like, wait, what are they talking about? Is that there are different phases of detoxification, right? We know about the liver
Mm-hmm.
being a an area of detoxification, but sometimes people don't realize that the colon also is an area that you're not only excreting toxins, but toxins can get reabsorbed, like you said, if you're not having regular bowel movements. So I just wanted to clarify that.
Yeah, no. And one more thing I want to add really quickly too, that just because, you know, a lot of times we also see a lot of blood sugar imbalances. Someone might not be necessarily have diabetes too, but their average blood sugar, like HbA1c, could be elevated. So I always tell my clients we do want to build those meals, whether for someone who's trying to conceive or they're in menopause, do like include lots of fiber on their plate, optimal protein, some complex carbs, healthy fiber, healthy fats, because we do want to support that healthy blood sugar because that's also going to help with balanced hormones, better sleep, because I always give this example. If we go through Starbucks, we get this like sugar-loaded coffee with a muffin or bagel, that's just not a great start. It's gonna start you where you're on a blood sugar roller coaster for the rest of the day, and then you craving more unhealthy foods, much harder to stay on a healthy lifestyle. So balancing, and some people do like to try like continuous glucose monitor if they need help, like really seeing what meals, but blood sugar is also a big help with balancing hormones and supporting healthy lifestyle.
Yes, yes. So these are all little tangible tips and tricks for people to get started on. And I love the supplement recommendations because those are the same ones, like or the same nutritional things I would focus on. So then, to kind of wrap this up, I would like to ask you, what are your self care non negotiables, and what kind of does your practice look like?
I love walking. I have to walk no matter where I am. That's my and meditations. Yeah, every day, even just for a couple of minutes a day. Even I have a toddler and my life is busy and I don't always get a great night of sleep. So those are like sunlight exposure, walk, and meditation as three things I can live without. I have to have them in my life. They make me feel better, help me to be a better human, have more energy, and just set myself up for success for the day ahead.
Okay, and do any particular time that you do this, or just anytime you have a moment to yourself?
I love to walk in the morning to get that sunlight exposure. I did this morning before it was getting too hot in Florida. With meditations, I like to do it before bedtime. That's when my daughter is asleep. I have some quiet, uninterrupted time. So I would do that for 5, 10 minutes, and it helps me like fall asleep faster, get that deeper sleep. But sometimes if I didn't sleep great, maybe like a little pick me up meditations throughout the day in the middle of the day, just like a quick reset, almost like a power nap to get me through the day and
Yeah.
feel better.
Okay. Well, thank you for sharing your non negotiables.
Yeah,
And
you're
thank you for
welcome.
coming on the podcast. I really
Yeah.
appreciate your time. I think that it's a good teaser for anybody who's interested in functional nutrition or just learning what functional nutrition is. So, Lucky Avocado
Yes.
Nutrition, I see that you offer 15, like free 15-minute consultations.
Yes,
Um,
yes.
yeah, so that is definitely a very helpful way for people to get to know you better as well.
Yes, thank you. Yeah, thank you. I'd love to help anyone.
Yeah, so thank you again for joining us, and I will be putting this podcast out next week.
Awesome. Sounds great. Thank you for having me.
Thank you, Liana.
Thanks.